There we go.
Oh wow, we got actual people.
We do.
One person with their camera on. We got two cameras. Let's see if we can get them all on. I am conscious that a lot of practices don't have cameras enabled in some of the setups, right? So no pressure. I can see some familiar names there.
It is lunchtime too, so I don't think anyone wants to see me stuffing my face with food.
It's all right, Carol.
Go on. We were just lamenting the when you I mean there's benefits obviously to having the video calls like this because you can connect with a bunch of people around the country. But the tricky part when you're doing the presenting is you're often talking into a void and you don't get that read of the room where you can make eye contact with people and stuff. So if anyone does feel like turning their camera on, even if you are stuffing your face in the meantime, I won't take any offense. I know if you've joined at this time, you're undoubtedly in your lunch break.
Was Carol. Well, as everybody knows, this is Al Duncan, and he owns Web Tools, and his product is Centric, and I will leave Al to carry on.
Oh, that's very kind. Thank you, Karen. I don't actually own Web Tools, but I am part of the Web Tools crew. But kia ora, everyone. Really appreciate you making the time to join today, particularly if you are eating into your lunch break. I know that can finding time in your day is rare, so making the time here I really appreciate that. I do recognise some names on the list here, but for those of you who don't know me or who I haven't met, my name is Al Duncan. Look, if you read my name often these days, people confuse me for AI. I am a real person. And I think some people can attest to that. But when you have a lanyard and it's lowercase L, then it gets people very confused these days. So the context has definitely changed there, I can tell you. But my role at Web Tools is Chief Growth Officer, although I tend to refer to myself as the Chief Mascot. So what that really means is that my job is to stay close to the health sector, really, and to understand what practices, what PHOs and what providers are navigating, and then map what we have in terms of our product set or in terms of our capabilities, and make sure that we're really bringing value to the patients and the providers and to the wider sector. So really, if I take wind the clock back a little bit, my background isn't in tech, and my background isn't in sales or actually even in being a mascot. It's in public health. So I did my master's in public health back more than 20 years ago, showing my age. So that's really what's brought me into the health sector, and I've been working in the health sector for nearly 20 years now. So my lens isn't when I'm talking to an audience like you, it's not around the apps as such, but it's more around how digital tools sit safely and sustainably inside the real world delivery that you're all responsible for. We're also fortunate enough to have our implementation specialist, Hannah, here. I can see you there, Hannah, who's just joining us today. Maybe you could just say hi to the crew from yourself.
Kia ora, hi from Christchurch. It's a really lovely day down here. I'm a part of the implementation team, so I work with practices when they make that decision to launch. It's a part of our platform offering that they'll have a support person, which is me, or one of our team walking through those steps with them.
Thanks, Hannah. So before we get into the actual presentation, kind of proper, I'll just give you a quick note on the format of this. So I don't have a slide deck to present. I don't normally operate in that way. I didn't want this to feel presentation heavy at all. So, but what I do want to do is frame up the conversation and then open it up to some Q&As at the end so that we can have some discussion around what's really relevant and useful to you all. But if something comes up while I'm speaking, then please feel free to interrupt. You can also drop a message into the chat. I think Hannah, you can keep an eye on the chat there so we can keep a tabs of what's coming in. But I don't take offence at being interrupted. In fact, I enjoy the interaction. So if you do have a question that pops up while I'm running through things, then feel free to jump in. And the other thing I want to be clear on is that this isn't a product pitch. Really what's happened in the sector this year, we felt it was more useful to take a step back from the work that we do day to day, and think more holistically about what about patient-facing platforms, and then things around the trust and the governance and the security rather than the feature sets. So what I'll cover today is a bit of context around web tools and what we deliver, so we all know where we're starting from. Then some additional context on the cybersecurity events that have happened across the sector this year, and then what we've done as a company in response to that. Talk a little bit about the shift that we're seeing in the sector and the conversations that we're having with practices and with the ministry, with PHOs and the like. The role of trust and governance in all of this, and then what good looks like in terms of security and privacy by design for products when you're considering what products you want to sign up to and subscribe to as a practice. And then practically for those interested, what's involved in when you, as a practice, in considering changing providers. So if any of that is interesting to you, then stick around. If you felt that this was an AI presentation about the use of AI tools, then feel free to jump out and enjoy your lunch break. But I'll start off by way of context. I'll give you a little bit of background on WebTools. So we're Otatahi Christchurch-based health tech company. We've been operating in New Zealand for nearly a decade now. Centric, which you might have heard of, that's our flagship patient engagement platform. That's something we've developed and operated and evolved over the last 5 years or so. You might have seen us at some of the PMAANZ conferences, for example, or the GP-CME events and the like over the last 5 years. Today, Centric powers patient-facing applications across general practice that you might be aware of, but also now more recently pharmacy, and we're also now stepping into the community care space. So across those sectors, the platform supports things like online bookings that you're familiar with, repeat prescriptions, secure messaging, payments, and sitting alongside your clinical system as a secure digital front door for patients. In general practice, we're powering a number of established patient-facing applications. So we've got the Doctors app for Green Cross, you might be familiar with, the Better Health Outcomes for the Better Health Group, which is a smaller private group in the South Island. We've recently launched and are now rolling out the Tomai app for Te Ora Compass Health and Health Hawke's Bay PHOs. That started, the build for that was last year, but we're now rolling that out across the Wellington region at the moment. And for independent practices, we offer our off-the-shelf Well brand that you might have seen. So when we're sitting down with PHOs and practices and healthcare providers, that's typically the context. We're talking about their patient app, their digital front door, and then how that functions day to day for their patients and their team. Up until this year, the questions we've received from practices, practice managers, GPs, groups, have been things like, does Centric support online bookings? Do you support multi-location? How does your messaging work? Do you have repeat prescription functionality? How configurable is the product? Those sort of things. And that all makes sense when you've got a portal already in place and you're evaluating whether another portal is actually meeting your need and delivering the functionality that means that matters for you and your patients. But that context definitely shifted this year. Like most people, my first awareness of the cybersecurity breach in January was through the media, and then it pretty quickly became obvious that it was going to be a very different start to the year for us at WebTools. Normally for us, January and February is pretty quiet. Practices are often closed or are managing leave. And we're focused on internal work and planning work and busy building and developing features. This year, my phone started ringing on the 1st of January, and it really hasn't stopped since. And what stood out to me particularly wasn't the volume of the calls, but it was more the nature of the conversations that I was having on those calls. So there was a lot of uncertainty from the people calling, concern, and in some cases, a real lack of clarity what this actually meant for practices and for patients. And it really hit me the impact that this was having on the sector. I know primary care, we're all familiar with how stretched primary care is. People were finally getting a break and enjoying, for those of you who did get some sun, enjoying a bit of summer. And then suddenly there was all of this pressure and responsibility landing in the middle of that. And what wasn't lost on me actually was the team at Manage My Health too. The people on the ground that were dealing with that situation, and amongst all of this, it was a really tough place to be for everyone. For us in Web Tools, the first thing we focused on was supporting our practices. We made the assumption pretty quickly that practices were going to be getting asked questions from patients that they wouldn't necessarily feel equipped to answer. And that's really an important point. The pressure doesn't just sit with the vendors, it also lands directly on the front desk for you at your practice. This is your front desk staff, your nurses, your administrators, the GPs, people who are already under a lot of load. So our focus was, how do we remove that load on them immediately, in the immediate term, noting that our product wasn't affected by that breach. However, that message is not understood broadly necessarily by the practices themselves, or certainly by the end patients. So we pulled together a whole bunch of email templates that practices could send to their patients. We created website content and banners, social media messaging, a set of expected FAQs with clear, plain language answers. We put together guidance for front desk teams so that they could handle calls coming from their patients when they were being asked about the situation and how they could answer that around our Centric product. And we made ourselves directly available to patients if practices needed to escalate that and the concerns from their patient population. The goal for us was around speed and clarity, so giving practices something that was usable straight away without needing to interpret or create anything for themselves. And then in parallel with that, we put together a Centric platform privacy and security FAQ document. And this was something that we distributed more broadly across the sector as well. So not just customers, but this was to boards and directors of PHOs, of corporate groups. We sent it out to organisations like PMAANZ, the Royal College, Royal New Zealand College of GPs, sent it out to PMAANZ as well. And the intent there wasn't to position us as kind of any kind of gold standard or look at us, we're doing things great. It was more about contributing something useful at a time when there were a lot of questions and there weren't a lot of clear answers. We were hearing the same concerns coming through though, and rather than wait to be asked, we thought we'd get ahead of that and acknowledge those concerns and provide clear and real practical answers to those questions. We were also approached by one of the larger PHOs at that time, asking what support we could provide for their member practices. So off the back of that, we pulled together a PHO support package as well, focused on onboarding and implementation. So really to help practices who might need to move quickly or need additional support through that process. So, and it was really challenging for us at that time. We didn't want to appear to be opportunistic, but we did want to be responsive to the sector to make sure that there was capacity and support available for those practices who needed it. And I actually did most of that from my camping trip. I had time booked away with my family that over the first couple of weeks of January, and you realise pretty quickly that I'm going to need to take my laptop on that, and had some very understanding kids. So that part of my camping trip was really juggling that balance of being a dad and also trying to respond to the sector at a time when our team was on leave as well. So at moments like that, you really do need to be available. And so our initial response was about supporting the sector first and removing the pressure when we could. Then from there, we turned inwards. So we looked at the things that we already had in place, where our risks were as a company and as a product, and what assumptions we needed to retest during that time. And what we had in place with Centric really became important in that moment too. So things like your regular independent security testing, what we call a deliberately minimal purpose limited data model, building the platform from the ground up with modern tech, that architectural separation where we're not holding a longitudinal clinical record for a patient, and that strong auditability and monitoring. So to make all of that a bit more concrete, we called these things out in that FAQ document so that it was clear to practices and anyone using our product or considering our product that we had things like multi-factor authentication in place and across the platform, that all of our data that we transfer or transmit between the patient and the practice is all encrypted when it's either at rest or when it's moving between the two systems. Having strong access controls in place with role-based permissions, having audit logging and traceability of all the actions of any of the users on the platform, and then that regular independent security testing and review. So the thing I really want to call out here is that we didn't fundamentally change how we operate as a company or as a product. What had changed though was what the sector was asking about. So we weren't being asked anymore, and we still aren't primarily being asked about features. The questions we're getting now are things like, who is the company that sits behind the product? Who is WebTools? Are you independently security tested? How is your patient data handled? What data do you have on our patients and on our practice? And what does the architecture actually look like? And getting questions from practices around architecture has been quite a novel experience, and it's nice to be able to provide those answers in a clear and concise way. So the focus really has moved from functionality of the features of the product to trust, and that shift for us is completely understandable. When a cybersecurity breach like what happened earlier this year, you experience something like that in a system that sits between your practice and your patients, it really forces us all to reassess the risk and not just focus on the feature sets. So trust. How we approach trust when we entered the patient portal space, we definitely weren't the incumbent. We didn't have a long-standing market presence to rely on. We have been around for a long time, but not specifically in this space. So from day one, we focused on building trust in the sector. And for us, that is built through behavior. And that behavior has three elements that we consider. So we have transparency, we've got partnership with the sector, and then consistency over time. So touching on the transparency part, that's not about transparency in the sense of just publishing a privacy policy when we're talking about privacy and security. This is about being open about how our platform is architected, how we integrate with your clinical systems, what data is stored and what data isn't stored, and how software is designed and how it's tested and how it's released over time. So that for us is things meant structured product updates. It's around our fortnightly release cycle for our product, early adopter programs for those who want to try out new features when we're building them, and being really clear on what our roadmap delivers and what you can expect to see in your feature sets over time. And that transparency allows practices and our partners to form their own view over time rather than just accepting our view of the world and our reassurance that this is how we operate. The second part that I want to touch on here on this, in terms of trust is our partnership. Centric wasn't designed in isolation and then presented to the sector. It's something that's evolved over the last 5 years through fortnightly co-design sessions with practices and with PHOs, making sure that we have a joint understanding of the needs and an agreement on the best way to actually meet those. Then we've got consistency. So we can say we're going to do these things, but unless you actually see the consistency through delivery, then it's all just talk. So regular releases, structured onboarding, our training academy where we release details about every feature that we deliver. Responsive support, so getting an answer when you have a question, getting a response. Getting support when you have a problem and seeing that support through to the problem being resolved, and then clear communication when any of these changes occur. So in many ways, the questions we're getting asked today from practices are the same questions we knew that we would need to answer from the beginning. And that's why in response to the current environment, we're taking that same approach that we've always had, which is just transparency and clarity in our communications. We also pulled together, as I touched on, that privacy and security FAQ document, which clearly documents our architecture, our data handling, our consent models, and independent testing, and it puts it all together in plain language. So if anyone's interested in that, if you haven't received it already, we're more than happy to share that with you, Karen, and you can distribute that out to any of the attendees. But fundamentally, like, who sits behind the platform? We're being asked that, like, who are WebTools? Who are the vendors that sit behind those systems that you're thinking about? So, and that's not a technical question. That's all around organisation, because patient portals, or what we like to call digital front doors now, to kind of differentiate a little bit from the past. They're not just apps, they're actually like ongoing infrastructure, key infrastructure sitting between your practice and your patients. So that infrastructure really deserves scrutiny. And different platforms in the market are backed in different ways. We've got founder-led, privately held companies like WebTools. You've got some that are owned offshore. You've got some that sit within large corporate groups. You've got some that are private equity owned. And none of those models are inherently wrong, but they do provide context and help you understand the intent of the organization you're subscribing to and the product you're subscribing to. Another question to ask is whether or not the platform has been designed from the ground up to be patient-facing infrastructure, or whether it was something that was added as an extension of something else or of another product. That infrastructure that is designed deliberately, so that's with governance and consent and with security boundaries all embedded right from day one. They tend to age better than functionality that has been added on as an afterthought or later in the piece. Then there's accountability. So things like who signs off security at the organization you're subscribing to, how often is the independent security testing conducted, what are the outcomes of that security testing, and the remediation plans in place from the provider, and how transparent is all of that in terms of documentation and communication with you. Because when something goes wrong, and in digital environments, incidents can happen. What's really important in those is the accountability. So for us, we've placed a strong emphasis on structured documentation, on regular independent security testing, and clear licensing agreements with those who subscribe to define those roles and responsibilities. But more broadly, the point here isn't about us. The point is that governance and intent shape the architecture of the products, and that architecture is definitely a foundation to security, fundamental to security. I've got a hand up from Hannah.
It's me. I'm just putting my hand up on behalf of the chat.
Sure.
Now might be a good segue. Kay's just asked, tell us what data and where is it stored, please, in reference to extraction, I'm assuming. And this may be a good lead into that security document, which details.
Yeah. So it's important to note when we're talking about the data that is held, there are two different ways in which you can the platforms in the sector are operating. One model is extracting the longitudinal record from the source system. So we integrate with medtech. So in that example, it would be extracting the longitudinal patient record and storing it somewhere else, and then using that data store to drive interactions. The other model is that data minimization or event-driven architecture, which is how Centric operates. So what that means is the data that we extract or we store from the source system is the data we need to drive the interactions and nothing more than that. And we've got a table in our privacy and security FAQ document. So I'll make sure that everybody gets that, and you can read through. It's quite detailed, but you need to think about it in the context of some data we hold will be the details that a patient will need to enter to register an app account. So that is a first name, surname, date of birth, and mobile number. And that data, those data are entered by the patient when they create their app account. So that's not taken from the source system. The things we need, as an example of data we have, are things like the appointment date and time that the patient has booked and has been confirmed in MedTech, for example, so that we can then trigger a reminder at a duration before that event, before that appointment, so we can trigger that reminder at the correct time. Things like the script that has been requested, so that we can then send a reminder notification about that script, or notifications of the status of that script as it goes through from being submitted to being approved. But like I mentioned, I won't go into all of those details because it's all documented in the privacy and security FAQ document, and gives all the context to that too. Hopefully that answers the question. We good?
There is
Any other
another question.
Excellent. Hit me.
Okay. As practice managers, we may not always know what to look for when selecting programs compatible with our PMS systems and business operations. Is there
Yes.
a recognized standard that organizations should follow or look for to help us filter out unsuitable options, ensuring companies have met due diligence requirements regarding data sovereignty, security, privacy, and similar criteria? Well written, Carol, that's nice.
That's a beautifully written question. The short answer is that there are no standards in the sector that vendors like us are required to meet. There are standards like the Health Information Privacy Code, the Privacy Act, and various other legislation pieces where we're required, like we're under the legislations, we're collectively required to meet those kind of conditions. However, what we have done, noting that, and I don't even know if you know this one, Hannah, what we have done on the back of being requested some information about our platform from one of the PHOs, is we've created a document which is effectively a series of questions that point out the best practice attributes that you should be considering when you're reviewing various patient-facing systems, or can be any system, actually, to be honest, any clinical system. And we've provided that. We've created a PDF document, so it's not branded web tools, and it's not about pushing a product, but it covers off all of the different elements that we would recommend that anybody consider when they're going through a review like this, and considering their options, to make sure that things like independent privacy and security reviews are conducted at a minimum of 12 months, and that you can provide attestation to that to show that that's been done, and you have a history of that being done over time. So I'm happy to share that too, Karen, to distribute around among the group, just to kind of cover off each of those different sections in terms of the data maturity, the information being captured, the best practice kind of principles. Thumbs up from Carol.
There's a thumbs up from Rachel.
Excellent.
But that's all your questions so far.
So that's, I mean, a lot of that is what I'm actually just about to touch on, which is around that kind of security and privacy by design. So this is kind of the architecture. When we talk about security by design, we're actually talking about the decisions and the principles that vendors can and should be considering. So the first part of that is architecture. So modern patient-facing platforms don't need to be duplicating those entire clinical data sets outside of the PMS. That creates for an organization, both the subscriber organization as well as the vendor, a long-term exposure risk. So in our case, Centrac integrates with MedTech, where we're not integrated with Industry, but we do integrate with MedTech through what I mentioned as those secure event-driven APIs. So it's a mechanism of data exchange that provides access in real time, and it's driven by the actions of the patient. So there's no bulk replication of that longitudinal record sitting outside of your source system. And importantly, when a practice is offboarded, So if you choose not to use our product, when a practice is offboarded, those connections are removed entirely. And that's a deliberate architectural choice, and that's designed to minimize exposure to us and exposure to you, and not unnecessarily replicating data when it's not required. So on that second principle of data minimization. So to operate safely, a platform does need to store some data, as I mentioned. So the things like the app registration account, as I touched on, the booking and repeat prescription, what we call metadata. So it is those kind of event-driven attributes of date and time, as well as messaging content, where the messaging feature is used. But that isn't around warehousing the full clinical record or the clinical histories. They all stay within the PMS, and that boundary for us and for you is really important. Third element to consider is the identity and access control. So when you're thinking about security, it's not just about preventing an attack, but it's also understanding who has access to what and under what conditions. So multi-factor authentication is a big part of that as well, where for us, it's in our platform, it's enforced for all of the clinical administrative users, and it's been available to patients on their app from day one. But those role-based access controls are applied at the practice end, and audit logging in place for all of those events. And then we've got the independent assurance, and I've banged that drum a few times in this session, but security posture from a vendor, and for us, it's not about trust us, we're secure. That regular independent, you might have heard the term penetration testing. So that's effectively when an organization like us contracts an independent third party to have access to our system, try and hack it, try and break through our security layers, and then provide us a report back onto how we've done on that. And that report back has what you have: critical, high. It's got a very kind of a series of scaled or tiered risks. And within those risks, whenever they're called out, between the organization and the security tester, you would expect there to be an agreed remediation plan, which is, yes, we recognize these risks, and here is the plan for us to address those and the way in which we would do that, or here's how they are risks that are accepted by the organization and the reasons why those risks are accepted. That's critical, and it's not just about being able to say you've done one. It's about being able to show a continued history that they have been conducted over time, and that those remediation plans and the outcomes of those reviews have been acted upon. Finally, that clarity of roles. So when a practice remains in control of their PMS, right? So the platform provider, as us, operates as a service provider with really defined contractual responsibilities, and those boundaries are really important, because that security is not just around the technical, it's around the legal, it's around the operational and the organizational boundaries. So thinking about it in the context of switching portals and being able to switch portals with confidence, we would love, and we've been through a series of transitions for practices and taken practices from one portal to our centric platform many times over the last sort of 5 years. And what we do continually experience is really a fear from practices about what this change would mean. What does it actually look like for providers? Because that's the underlying tension. If trust has shifted, that change feels really, really risky, and that's completely understandable. But a portal isn't just about an app. I touched on the critical infrastructure, but it's really embedded into all of your workflows. It's embedded into your patients' habits, what they do day to day, and it's embedded into communication patterns between you and your patients. So that assumption that switching will be disruptive or technically complex, that's something that we see there. But in reality, most of the risk isn't technical, it's really around planning. So switching platforms, when it's done properly and it's structured, tends to follow a really clear sequence that starts with contract clarity. So being able to understand things like your notice period, understanding the data obligations, to Kay's point, things like understanding what data is being held by the system that you're subscribing to and for what reasons, being able to have that documented and understood. The second part is around the data, the integration and that data transition planning. Because platforms like ours use those API-based integrations, there is no bulk replication of that data. So that means when you transition from your existing provider to a portal like ours that's driven by those APIs, it's all about creating a new secure connection, not around migrating data from one system to the next. We have no data migration required in a transition. It's a new connection to your source system, and the patient, when they register, is able to access their information in real time from the source. And when that information changes in the source, that information is reflected in the patient's app when they're using it. Do we have another question, Hannah? You're on mute.
Apologies. In the chat, Emily Bell just asked, do you provide information designed for patients with no technology to explain how data is held, or more importantly, not held by Centric? I have put a brief answer there regarding the help centre that is part of the patient portal app. Our AI help bot called Rick, not our human being, and our support team who is local to Christchurch and would be able to assist with that and address those questions.
Yeah, and the other part, which is something we've actually got currently underway at the moment, it's sitting with legal for review, is we've gone back to all of our privacy and security documentation, and what we've done is revise it in plain language. You know what T's and C's are normally like in when signing up for different services or different products. And I mean, I'm as guilty as the next in just ticking the box and moving on because you know what you want or know what you need. But actually, there's a real need in this space for there to be plain language information available to both practices and to patients. So whilst we have had privacy and security T's and C's available through both from the app and in the in the contract side of things for a practice, that's all getting rewritten and revised at the moment and being reviewed so that we can present a plain language version to anyone who's accessing it. The other part is we've also updated our website to have some really publicly and person-friendly information available through our Centric website. And so again, back to my point earlier, it's not questions we've ever been asked before, but it's certainly stuff we've had there and in a security and privacy position that has been well understood and but not in a publicly facing kind of consumable way. So we spent a lot of time on that over the last sort of 3 months, making sure that that's accessible and visible. Any other questions? No. I was no problem, Emily. So I touched on the integration. So there was, I mean, there is a general theme out there in general practice that if you used to switch providers, there needs to be that data migration. And what does that data migration look like? The reality is that that's not necessary. We don't create or replicate a new data store. We simply connect the system to your practice management system in real time. So next part in considering a transition is around communication, and there's multiple levels of that communication. There's the clear messaging to your own staff. So if you're going to make a switch, being able to communicate that clearly to your staff as to why you're making that switch, what are the benefits to the organization, what are the benefits to the patient. Second is the messaging out to your patients themselves, and then there's how do you provide, or what collateral and structured guidance do you get in creating and presenting that communication. So most patient disruption really comes from unclear communication rather than from technical failure. We have a full kind of communication structure when any practice chooses to launch with us, which involves things like pre-launch, launch day, post-launch day communications via email. We have text campaigns. We've got social media tiles, we've got website banners and content, and practices have the option to use that, or they have the option to create their own. When they use the content, they get a really good result, and are really grateful for that, because it's a lot of work goes into thinking about how to send or how to communicate these changes internally and externally, and then making sure that there is structure there to do so. Then one of the other things to consider is parallel running. So if you're making a switch, is the switch from one provider to another a hard cutover, or is there an opportunity to run the two systems in parallel? So that overlap period can provide practices with a chance to kind of get things embedded and feel really confident with the system before they launch, before they switch. So with the Centro platform, the normal process is that we would connect connect Centric to your practice, and we would take you through a trial phase, and that trial phase is normally for a 1-month period, and it connects a production Centric platform to your production medtech instance. And then we take you through an onboarding session where we connect. We take your staff on a journey, downloading the app, connecting yourselves to your own practice using dummy patient records or your own clinical record if you're a patient at your practice, taking you through each of the different feature sets, the different configuration options for those, and then checking in with you on a regular cadence so that you have the confidence to learn at your own pace or trial things at your own pace, but knowing that you've got the support there from us to answer any questions as they may come up during that time. And that can be done, and that is done without affecting any of your other systems that you're using. So you can have that confidence to trial something. You can see whether or not it is actually what you thought it was or what we've said it is, and then have that confidence to make a decision based on real usage rather than an interpretation of what it might be like. So that's probably enough from me for the monologue. I want to open it up to Q&A. I mean, ultimately, if I take kind of a step back from all of this, the short version for us from WebTools is that the context this year hasn't changed the fundamentals. It hasn't changed the way in which we operate, but it has changed what's important to the sector and the kind of questions that we're asking. And that's really a good thing. And the good news for us is that we know what good looks like, and we've been executing on that for the last 5 years. So if you're curious, would like to know more, or you've got a bunch of questions, then let's get into it.
There is one more in the chat. It is from Kay. My understanding is that if we shift as a practice, then the patient info still sits with the current provider. Is that correct?
I mean, the short answer is I'm not really in a position to talk on other providers. You have a contractual arrangement with whichever provider you have in place. In the context of Manage My Health, I do know that it's public knowledge that there is some challenges with regards to what happens with that patient data once the contract has ended. When we transition a practice off Manage My Health, we do encourage the practice to contact Manage My Health directly and get them to confirm that they no longer have any information relating to your practice or your patients. And we've had varying degrees of success from the practices' feedback to us on that being confirmed. So that really comes down to that contractual relationship you have. And the reassurance or the follow through that you get from your provider. I'm also aware there are conversations going on at the PHO level, specifically in the context of all of these breaches this year. So there is an opportunity there as a practice if you don't have much success in that regard, to look for support from your PHO as well. silence. So open up to the floor. So I have some actions on there. I'm going to share the privacy and security FAQ document. Karen, I'll share it with you to distribute. Is that okay?
That'll be fine.
And also to share the document I've created with together with the PHO around evaluating different portal providers, so that you have a starting point. And if you'd like us to complete one of those, we'd be happy to do that too. But the template is simply a template, not completed, but it gives you the kind of different attributes to consider when you're either reviewing your existing portal provider and looking for additional information, or you're looking at changing. Happy to share that as well.
So, Al, do you have demo webinars?
Oh, yes. Good question. Hannah, should I hand over to you on that one?
Yes, we do. We do have demo webinars. It's a new initiative we've just started, actually. Our first one was yesterday. And this just allows us to present the features end to end and answer specific questions live on a call, because what we're finding is that during implementations, no practice operates in the same way. And so sometimes you're reading a pamphlet and it's hard to grasp how that feature may look with your use case or your setup. So what we decided is that it may be more beneficial for practices to offer live demos where they can explain the use case, and then we can address how the configuration can be set up to match and fit their practice and patient cohort.
That sounds
so
really
we can
cool.
make a link available. Sorry, I should have followed that up.
It's all right. I'm known as a nagger and to pass things on.
And have we
I
got
think I am too at home.
We've got other questions in the chat here as well. My chat's slowly loading. The same questions. That's okay. Okay, that's all. We've answered all of those. I mean, we've got. I think we had through till 1:30. I'm happy to boot up the app and give you a quick run through if anyone's interested. But noting that this wasn't actually a product a product sell, more a case of like talking through the context and some of the things to consider.
Will you be coming to our conference in Wellington?
Absolutely, we'll be there with bells on. So I think we've been at the last. I think our first one was 4 years ago at PMAANZ. We were big fans. Last year was pretty special, flying all the way over to Melbourne. But next year will be. This year will be in Wellington. I think I've actually just had confirmed a speaking slot as well, which is nice. So either with the exception of a letter, I think I might have put everyone else to sleep, or there are no more questions because I can't see anyone else's faces.
Is there any other questions anybody else wants to ask? Carol?
And I am happy to just boot. I can launch one of the apps if anyone's interested, just to run through for 5 minutes. Show the different. Okay, maybe I'll do that then. Let's see if I can make this work. This will be interesting.
While you're doing that, Al, can I ask what PMS systems you work with? Did you just say just Industry or?
No. Oh, sorry, just MedTech.
Just MedTech.
Yeah. So, right. And I know that's what we've built the system to be what we call agnostic of the source, which means that we built it in a way to allow to integrate with multiple practice management systems or source systems. So at the moment, we're integrated with MedTech, and we do that through the Alex API layer. We're also integrated with Tonic, so the pharmacy management system for pharmacy use case. We've now got there's a couple of other kind of community-based systems or community-based organizations, nationwide organizations who we are in. We're in what we call the discovery phase, which is where we work together with the providers to understand and fully flesh out the features that we need to build, and then we go into the build phase for that. So there's a couple of nationwide providers will be announcing in due course when that comes, but that's kind of realizing our broader vision of that digital front door. So it's not about just a one-to-one connection between a patient and their general practice. We've extracted, or we've brought up a level the centric account and allowing you to switch between accounts through a single app. So if you are connected with a pharmacy, or you might be connected with your community service provider, then you can actually access that with the same credentials that you've used to register your app account for your general practice. So an example of that is we're excited to be launching with local health it'll be in May, so it's the start of May, and I'll be flying up and to Palmerston North to their new Taha site on their open day. I think that's on the 13th of May. They've created what we call a white label or a branded app, but it's all done on the same platform. It's all the same functionality, but they've got their own brand and they can control the feature set for their member practices. But the use case there is they've also invited pharmacies to become part of their local health community, and so we're now working with the local pharmacies in that region to allow them to connect in as well, which is a pretty exciting use case. It's starting to think more broadly to, if a patient orders a repeat prescription through their general practitioner and it gets sent off to the pharmacy, then being able to receive notifications from the pharmacy when it's ready to collect, being refill reminders from the pharmacy when your refills are coming up for expiry, those sort of things. So it's that kind of that broader, more holistic, patient-centered use case. I will share my screen real quick now, though, so you can kind of get a look and feel for this. Here we go. Oh, there we go. Can you see my screen okay? You're going to see a whole heap of app tiles. Actually, there's a little bit of a spoiler alert there for one of them. You can see our Test Nurse Maud app. So they're a community service provider based in Christchurch, actually, Aotearoa Christchurch, but they have a contract across the South Island. But you can see all the kind of different rows of apps here. So we've got our Well app. If you look at the top, we've got the Well app, then we've got the Tomai app for Te Ora Compass Health and Health Hawke's Bay, the Doctors app for Green Cross, and the Better Health Outcomes app for Better Health Group. Then underneath, we've got the Unichem and Life Pharmacy app, which we launched. We did a soft launch with Green Cross at the end of last year, and then there'll be come May the 1st, we're calling it May Day, they'll be launching that out publicly to all of the, publicly through their Unichem and Life and Life Pharmacy promotions. But what I'm going to do is I'm going to launch into the Well app. So I've configured this app here to be configured so that we have dependents enabled. So in this scenario, I'm L, or AI as it might look like. But I've also connected to my children. I've got little L and I've got littlest L. So I'm able to, when I have those accounts connected, I'm able to switch between. So to be able to book appointments for, order repeat prescriptions for, those sort of things for my dependents. That's a new feature we launched at the end of last year. But I'm going to go into my L account. So this is my master account. You can see the little spinner. So that little spinner is unique when you connect through those APIs. So that is a real-time connection from the app to the source system. We're connected to a medtech instance that we host. So this is real live connections, but it's all test data. Things that you'll note when we're going through the app, we've got the quick action buttons at the top for booking appointment and ordering repeat prescriptions. You'll see your health records updated just now, so that's showing the real-time connection. Over time, that'll be updated 3 minutes ago, updated 1 hour ago, and it's a pull down to refresh to return back the most recent information. We've got the 3 most recently changed attributes in my health record here around the prescriptions. And then I can also select all health records, which is where I see my health records as they are in MedTech. Is that showing up on the screen? No, it's not. Apologies. Is that showing?
Yeah, we can see your screen.
It's lagging though, isn't it? There's quite a lag on that. Sorry for the. I can see on my screen here. I'm still. If I go out of this, might You're stuck on, you can see SR referrals on that screen though at the moment, right?
Yeah.
Yeah, it's not moving at the same rate that I'm sharing it on my actual screen, which is really interesting. Let me just I'll just stop sharing my screen for a second and reconnect. Any questions while I do that?
Yeah, just a quick one, Al. You know how you had your children attached to
Yes.
your login? Do you have a system when they turn 16 or something like that, it can be deactivated?
Yes, that's a very
Because I
good
think
question.
a lot of practices are doing this manually, which can be quite a
Yeah,
process.
yeah. I mean, actually my whole screen's freeze. But Frozen? Can you see me? Okay, here we go.
Yeah.
Yeah, I'm having a real problem now. All of a sudden, my connectivity's just gone out the wazoo. Apologies for that. The short answer is yes. So we've got a feature in there where you can set an age where it automatically disconnects. And that's entirely up to the practice. The other part, and can feel free to jump in here, Hannah. The other part there is that whilst we have technically the ability to connect automatically or get a dependent connected automatically in the co-design process with the practices, it was consensus on the practice side that they wanted to do that connection manually. So the disconnect is automatic at the age that's set by the practice, but the connection requires the practice to enable that. So the request goes through, it goes into an area in Centric where you can approve that connection, and then the account becomes available to the end user. But noting that that's entirely dependent on your process. So we encourage the practices to have a clear process, obviously, at their end. And every practice may have nuances or variations in that, but being able to have a process, an organizational process that ensures that you are enabling those connections for those who you deem to be able to be connected to that dependent, if that makes sense.
Because like sometimes you've got your separated parents, can
Yes.
both of them access the children's notes, or does it just have to be one or the other?
No, you can have unlimited, unlimited connections to that, but each one of those needs to be approved independently, and each one can be disconnected also at the practice end.
I think we've only got about 4 minutes to go, Al.
Yes, we do. Apologies for that wee blip on the on my connectivity. Yeah, it's I'm not sure quite why that happened, but it's a lag at my end rather than an issue here with the app. But what I'll do is encourage you. I think after this, Hannah, again, something we can provide Karen is the details for those the webinars with the demo. So if anyone's interested in having a demo or joining those demo webinars, then feel free to do so. Or if anyone's just interested in connecting with us directly and having a trial, the trials are free of charge. So what we do is we get you to sign a contract with us, which includes a free trial period that is for 1 month, but also extendable by mutual agreement. And what we do with that contract once it's signed is we share that with MedTech, copying in the practice or the practice manager. And that provides MedTech with the permissions they need from you to connect us to your practice. And then once that connection is done, and after the contract is signed and provided, that's normally same day service from MedTech. They're really fast to turn those around. Then Hannah or one of our other implementation team will be in touch following that to set up an onboarding session, which is normally about an hour and a half long, to get you familiar with the platform, what can be configured, and the various stages through that onboarding process, get you to download the app, and then have a trial at your own pace. So it's super simple.
Are you looking at going on board with other PMS systems? We're just going to stick with MedTech.
Just a thumbs up there from Carol. So we've done our first integration we've done with Indice is actually on what we call next available. So we've created an integration there where we can present next available appointments at Indice, and we did that for Green Cross. So that was part of their refresh of the doctor's website. They wanted to be able to present for each of their practices, both the in-person or the in-practice appointments, but also the doctors online, which actually uses Indice. So we did that initial integration. We have demand from practices who are really interested in our product, but they're using Indice. The challenge is that Indice has its own patient portal, and they will need, and we've actually had a conversation at the PHO level. There's two of the large PHOs in the north of both want us to get this integration, but the demand needs to come from the users, not from us as a vendor. So we have a good relationship with Valencia and the team there. They need demand from their user base if they're looking for a change in portal for us to be able to do that work, and we're willing and able to do it. Just need to get that agreement from Valencia to be able to do so.
Oh, that's
I think
great.
the other practice, the PMS system that, and the other larger one, I suppose, is My Practice, which we don't have an integration with. And given the lift required to do that integration, we're unlikely to do that. The initial work we did with MedTech, when we did the Alex integration, was My Practice was looking to actually integrate using Alex as well. So it would have allowed us to do both of those systems through that one integration. That never eventuated. So unfortunately, we don't have that integration. And because the number of practices is so small and the effort required to do that integration is really large, it doesn't make a lot of sense for us as a company to do that. And it's disappointing, but we can't do everything, unfortunately.
Has anybody got any more questions for Al? Well, I'd just like to say thank you very much, Al, for your little chin wag today.
My absolute pleasure. And if anyone ever feels like getting in touch, either just to share some of your experiences, or to run through any of the features, or have a chat just more broadly, and hopefully you've got my contact details. Feel free to share them, Karen, and hopefully I get to cross paths with you all at the PMAANZ conference later this year, if not before.
Well, thank you very much. See you all next time.
Okay. Ka kite.
Ka kite.